Hello, I'm Mackenzie, stuck with System Education, and I'm here to talk to you today about new changes coming down the pike with enteral feeding connections. So up to this point in healthcare, there's been several sentinel events related to misconnections involving tube feeding, meaning tube feeding was put into a central line, tube feeding was put into an ICP, and tube feeding was obviously put in the wrong place. So Joint Commission has worked with ISO, or the International Organization of Standardization, to develop standards for the entire nation on how to prevent those misconnections. So currently with our tube feeding, we have this end with this end from the kangaroo feeding. The kangaroo end change to this lure lock. Well, you'll note that the lure lock will not fit into the old connection style. So your packaging where your kangaroo tube feeding is going to come with a Christmas tree adapter, and that will connect onto here. Cap comes off, and then that will fit into the old piece. Now once we this Christmas tree will not be needed anymore because the new Dobhoff ending is going to have the opposite side of the lure lock. So those will connect like that. Now in the spring, there will be cases where you'll have a patient that had a PEG tube that's been in for 2 years. They're not planning on transitioning or taking those out. They would just slowly transition into using the new equipment. So at that time, you may still need to use the Christmas tree adapter to push into the old end. When the connection is officially changed in the spring, there will also be a new syringe style for medication administration for manual flushes.